Dry mouth causes are often misunderstood, and most people never think about dry mouth treatment until it's too late.
You wake up, and before your eyes are even fully open, your body is already asking for something. Not food, not movement, not even air, water.
That urgent, almost desperate need to reach for water the second you wake up. And if you are over 60, if you wake up with dry mouth more often than you'd like to admit, I want you to stop right here and really think about it. Because that moment, that exact moment, is one of the most ignored warning signs in senior health care today. I had a patient, Mr. Harold Bennett, 71 years old, living alone in a quiet neighborhood in California. No major complaints, no dramatic symptoms. The kind of man most people would say is doing just fine. But every morning his day started the same way. He didn't wake up refreshed. He didn't wake up thinking about breakfast or his plans. He woke up because his mouth felt completely dry. His tongue stuck to the roof of his mouth. His throat felt tight, almost irritated. His lips were dry before he even got out of bed. And without thinking, he would reach for the same bottle of water sitting next to him. A few long sips, a slow breath, a quick swallow. Then he moved on. That was his routine. And like millions of older adults across the United States, he thought absolutely nothing of it. He told himself, it's just part of getting older. He told himself, maybe I didn't drink enough water yesterday. He told himself what most people tell themselves when something feels small. That it's normal, that it doesn't matter, that it can wait. But here's what most people don't realize. When you wake up with dry mouth again and again, when your body repeats the same signal every single morning, it is not random. It is not harmless. It is one of the early dry mouth causes that often gets overlooked, especially in elderly health. And in many cases, it is the first visible clue that something deeper is happening inside your body. Now, I'm not saying this to scare you. I'm saying this because I've seen too many patients just like Harold, people who ignored something small, something easy to dismiss, only to later discover it was connected to something much more serious. And the most dangerous part is this. Harold didn't feel sick. He didn't feel pain. He wasn't worried. There was no urgency, no alarm, no reason, at least in his mind, to look deeper into what causes dry mouth while sleeping. And that's exactly why signs like this get missed, because they don't interrupt your life until they do. So if you are someone who regularly wakes up with dry mouth, if you've ever wondered whether it means something more, or if you've simply been brushing it off as part of aging, I want you to stay with me, because what I'm about to show you may completely change how you understand your own body and how you approach dry mouth treatment moving forward. If the first thing your body asks for every morning is water, it may not be thirst, it may be a warning. And in Harold's case, that warning had nothing to do with hydration at all. What most people ignore is often where the real problem begins. Before we go any further, let me ask you to do one thing. If stories like this make you stop and think about aging, about independence, about what really matters, take a second to like this video and subscribe. This channel shares stories that don't sugarcoat getting older. And today's story might change how you see it entirely. Because what I'm about to tell you isn't theory. It's what happens when a simple symptom like dry mouth is ignored for far too long, and what it revealed when we finally decided to look deeper. Now, let's continue the story. That something deeper, in Harold's case, had nothing to do with how much water he drank. It had everything to do with how he was breathing. And more importantly, how he was not breathing while he slept. When a patient tells me they wake up with dry mouth almost every single morning, one of the very first dry mouth causes I investigate is something most people never even consider: sleep apnea. Now let me be very clear with you. Sleep apnea is not just snoring. It is not just poor sleep. And it is definitely not something you should brush off as normal aging. It is a condition where your airway repeatedly collapses while you are asleep, sometimes dozens, even hundreds of times in a single night. And when that airway closes, even for a few seconds, something critical happens inside your body. Your oxygen levels begin to drop. Your brain senses that drop immediately, and it goes into a kind of emergency response mode. It forces your body to breathe again, often by opening your mouth wider to pull in as much air as possible. And this is where the connection begins. Because when you are breathing through your mouth all night long, air is constantly moving across the tissues in your mouth and throat. That airflow dries everything out. It strips away moisture that your body is supposed to maintain, even during sleep. Over time, night after night, this leads to what many people experience as sleep apnea dry mouth. But here is the part that should really get your attention. The dry mouth is not the problem. The dry mouth is the signal. It is your body's way of telling you that something is interfering with your breathing while you sleep. And if that interference is caused by sleep apnea, then what you are dealing with is not just discomfort. It is a condition that puts real, measurable stress on your entire body. Every time your airway closes, your heart has to work harder, your blood pressure spikes, stress hormones are released. Your body is pulled out of deep restorative sleep over and over again, even if you don't remember it happening. And this is why so many people with sleep apnea wake up feeling exhausted, even after what should have been a full night's rest. But again, not everyone notices the fatigue. Not everyone notices the interruptions in their sleep. Sometimes the only thing they notice is the dry mouth. I remember a patient, Eleanor Price, 66 years old, from Ohio. She came in for a routine visit. Nothing urgent, nothing alarming. But during our conversation, she casually mentioned that she woke up with dry mouth almost every morning. She laughed it off and said, "I just keep a glass of water by my bed now. It fixes it." That sentence right there, that casual dismissal, is something I hear all the time. But I asked her a few more questions. I asked if she snored. She said yes. I asked if she ever woke up feeling like she needed to catch her breath. She paused, then said yes again. I asked if she felt tired during the day, even when she thought she slept enough hours. Yes. That was enough for me to recommend a sleep study. And what we found changed everything. She had moderate to severe obstructive sleep apnea. Her oxygen levels were dropping multiple times per hour, every single night. Her body had been under constant strain, and she had no idea. To her, the only noticeable symptom was dry mouth. That is how silent this condition can be. And that is why understanding what causes dry mouth while sleeping is so important, especially in senior health care. Because in many cases, it is not about hydration. It is about airflow. It is about oxygen. It is about whether your body is able to sustain normal breathing patterns while you sleep. Now think about this for a moment. If your body is struggling to get oxygen night after night, week after week, year after year, what do you think happens over time? Your risk of high blood pressure increases. Your risk of heart disease increases. Your risk of stroke increases. Even your risk of irregular heart rhythms and sudden cardiac events begins to rise. And it all starts with something that feels so small. Waking up with dry mouth. This is why I tell my patients, and I'll tell you the same thing, if you are experiencing dry mouth regularly in the morning, do not assume it is just dehydration. Do not assume the solution is simply more water. Because if sleep apnea is the underlying cause, then no amount of water is going to fix the real problem. You don't need more water, you need better breathing. And once you start to see that connection, once you understand that dry mouth causes like sleep apnea are not just local issues but whole body warnings, you begin to look at this symptom very differently. Because now, it's no longer just about dry mouth treatment. It's about protecting your heart, your brain, and your overall health as you age. And what makes this even more important is that sleep apnea is only one piece of the puzzle. Because in patients like Harold, there is often more than one factor at play. And what we uncovered next was something even more common and even more overlooked. In fact, these are causes number 2 and number 3 on the list of the most frequent dry mouth causes I see in my patients. And the reason they are so dangerous is simple. Most people are not just exposed to one of them. They are living with both at the same time. Let's start with medications. If you are over the age of 60 and living in the United States, there's a very high chance that you are taking at least one prescription medication every single day. In many cases, it's not just one, it's 3, 4, sometimes even more. Blood pressure medications, antidepressants, allergy medications, sleep aids, pain relievers. The list goes on. Now here's what most people are never told clearly enough. Many of these medications directly affect your body's ability to produce saliva. They slow it down, they reduce it, and over time, they can leave your mouth significantly drier than it should be, especially while you sleep. So when you wake up with dry mouth, it may not be about what you drank or didn't drink the night before. It may be about what you took. Blood pressure medications, especially diuretics, pull fluid out of your body. Antidepressants, particularly SSRIs and tricyclics, are well known for causing dry mouth. Allergy medications, the ones people take almost casually, can be some of the strongest contributors to xerostomia. And the pattern is always the same. The medication helps one condition. Blood pressure improves, mood stabilizes, allergies calm down. But at the same time, something else quietly begins to change. Saliva production drops, your mouth becomes drier, and that dryness becomes your new normal. This is why I always tell my patients, sometimes what helps one part of your body silently harms another. Now, I want to be very clear. I am not telling you to stop taking your medications. That would be dangerous and irresponsible. What I am telling you is this. If you are experiencing persistent dry mouth, if you are noticing that it has become a regular part of your mornings, you need to start asking a different question. Not just, how do I fix this? But, what is causing this? Because effective dry mouth treatment always begins with identifying the real cause. And for millions of seniors, medication is a major part of that answer. But it doesn't stop there. Because the third cause, the one that often goes completely unnoticed, is not something you take. It's something you carry with you every single day. Stress. Now, when people hear the word stress, they often think about work deadlines or busy schedules. But in elderly health, stress looks very different. It can be loneliness. It can be the quiet anxiety of living alone. It can be worrying about your health, your independence, your future. And here's what happens inside your body when that kind of stress becomes constant. Your nervous system shifts into what we call a fight-or-flight state. This is a survival response. It's designed to prepare your body for immediate action. But in doing so, it shuts down or reduces functions that are not considered essential in that moment. Digestion slows down, and saliva production drops. Now imagine going to bed in that state. Your body is lying down, but your mind is still active. Your system is still alert. You are not fully relaxed, even if you think you are. You fall asleep, but your body never truly enters deep, restorative rest. Your breathing becomes shallow. Your mouth opens more easily, and your already reduced saliva production drops even further, so you wake up with dry mouth again. And this is why so many people struggle to understand what causes dry mouth while sleeping. Because the cause is not always physical in the way we expect. Sometimes it is neurological. Sometimes it is emotional. Sometimes it is the result of a system that has been under pressure for far too long. And the most important thing you need to understand is this. You're not just dealing with dryness. You're dealing with a body that is not fully at rest. You're not resting. Your body is surviving the night. And by the time you wake up, that dryness is just the first sign that something inside you never truly shut down. Now, if medication and stress are already part of your daily life, and for many seniors they are, then what we need to look at next becomes even more important, because the next cause is something that doesn't just affect your mouth. It affects your entire metabolism, and in many cases, it develops so slowly, so quietly, that people live with it for years before they ever realize what's happening. This is cause number 4 on the list of the most common dry mouth causes I see in older adults. Diabetes. Now, I want you to pay very close attention to this, because the signs often show up long before a diagnosis is ever made. It usually starts with something simple. You feel more thirsty than usual. You find yourself drinking more water throughout the day. You wake up once, sometimes twice, maybe even 3 times during the night just to use the bathroom, and when you wake up in the morning, you feel it again. Dry mouth. Now here's what's actually happening inside your body. When your blood sugar levels rise above normal, your body tries to get rid of that excess glucose through your kidneys. That means more urine production. And when you urinate more frequently, you lose more fluid. Fluid loss leads to dehydration, and dehydration leads directly to dry mouth. This is why understanding what causes dry mouth while sleeping is so important, because sometimes the cause is not in your mouth at all, it's in your bloodstream. I had a patient, Daniel Brooks, 64 years old, living in Florida. He told me he thought his symptoms were just part of living in a warm climate. He said, "It's hot down here, of course I'm thirsty." He was drinking more water than usual, waking up at night, feeling a little more tired than he expected. And yes, waking up with dry mouth almost every morning. To him, it all made sense. Until we ran a simple blood test. His blood sugar levels were elevated. Not dangerously high yet, but clearly moving in the direction of prediabetes. And that's when everything started to connect. The thirst, the nighttime urination, the fatigue, the dry mouth. All part of the same process. This is why I often tell my patients, dry mouth is often the first whisper of a much louder disease, because by the time diabetes becomes obvious, the body has already been under strain for a long time. But if you catch it early, if you recognize the signs, you have a chance to change the trajectory completely. Now, let's move to cause number 5. And this is where things become even more deceptive. Because this cause doesn't feel like a disease at all. It feels like everyday life. Chronic dehydration. Now most people will immediately say, "I drink plenty of water." But here's the problem. Hydration is not just about how much water you drink. It's about how much water your body actually retains. And in modern American lifestyles, there are multiple factors working against that balance. You start your morning with coffee. Caffeine acts as a mild diuretic, increasing fluid loss. You go through your day, maybe not drinking as consistently as you think. In the evening, you might have a glass of wine, or 2. Alcohol further dehydrates your system. Then you go to sleep in a room with the heater running in the winter, or the air conditioning running in the summer. Both reduce humidity in the air, pulling moisture away from your body while you sleep. And slowly, over time, you enter a state of low-level, chronic dehydration. Not severe enough to send you to the hospital, but enough to affect how your body functions, enough to reduce saliva production, enough to leave you waking up with dry mouth again and again. This is why dry mouth causes like dehydration are often misunderstood. People think in extremes. They think dehydration means severe thirst or dizziness. But in reality, it often shows up in much subtler ways, like waking up with dry mouth, like feeling slightly fatigued, like needing more water than you used to. And the most important thing to understand is this: you don't feel dehydrated until your body starts breaking down. By the time the signal becomes obvious, the imbalance has already been there for a while. And if you combine this with the other factors we've already discussed, sleep apnea, medications, stress, you begin to see the bigger picture. This is not one single cause. This is a system under pressure from multiple directions. And that's exactly why dry mouth treatment is not as simple as drinking more water. It requires understanding what your body is actually trying to tell you, because what we've covered so far are the most common causes. But there is still one more cause, one that many doctors don't immediately consider, and one that can quietly affect your body for years before it's ever identified. Because what we've covered so far are the most common causes. But there is still one more cause, one that many doctors don't immediately consider, and one that can quietly affect your body for years before it's ever identified. This is cause number 6, an autoimmune condition known as Sjögren syndrome. Now, this is not something most people have heard of, and that's exactly what makes it so dangerous. Sjögren's is a condition where your immune system, your own defense system, starts attacking the glands responsible for producing moisture in your body. Most importantly, your salivary glands and your tear glands. So what happens over time? Your body produces less saliva. Your mouth becomes chronically dry. Your eyes feel irritated, dry, sometimes even gritty. And unlike the other dry mouth causes we've discussed, this one doesn't come and go. It stays. It builds, and it often gets worse. I've had patients who lived with this for years, sometimes a decade or more, before anyone ever connected the dots. They kept asking for dry mouth treatment, trying different solutions, drinking more water, using lozenges, switching toothpaste. But nothing worked long term, because the problem wasn't on the surface. It was systemic. And that's what makes Sjögren so difficult to catch early. It doesn't feel dramatic. It doesn't feel urgent. It just feels persistent. Dry mouth that doesn't go away. Dry eyes that become part of daily life. Fatigue that's hard to explain. And over time, patients start to normalize it. They adapt. They adjust. They stop asking questions. But here's what you need to understand. When your body stops producing enough saliva, you are not just losing comfort, you are losing protection. Because saliva is not just moisture, it is one of the most important defense systems in your mouth. It controls bacteria, it neutralizes acids, it protects your teeth and your gums. And when that system is compromised, whether from Sjögren's, medication, sleep apnea, or chronic dehydration, the consequences begin to unfold. Slowly at first, then all at once. This is where everything we've been talking about comes together. Dry mouth leads to changes in your oral environment. Bacteria begin to shift. Harmful bacteria start to dominate. This leads to cavities, gum inflammation, gum disease. And here's where most people stop paying attention because they think it's just dental. But it doesn't stop there, because gum disease is not isolated to your mouth. Research from institutions like the American Heart Association has shown a clear connection between chronic gum disease and cardiovascular conditions. Heart disease, stroke risk, inflammation throughout the body. This is the domino effect that most people never see coming. It starts with something small, something quiet, something that feels easy to ignore, waking up with dry mouth, and over time, that small signal begins to connect with other systems in your body. Your immune system, your cardiovascular system, your metabolic health. This is why dry mouth causes should never be dismissed as minor inconveniences. They are often early indicators of deeper imbalances that, if left unaddressed, can evolve into serious health conditions. And this is also why proper dry mouth treatment is not just about comfort. It is about prevention. Prevention of dental decay. Prevention of chronic inflammation. Prevention of long-term systemic disease. Because by the time those conditions are diagnosed, the process has already been in motion for a long time. And that brings me to the most important point of this entire step. It doesn't start with a diagnosis. It starts with something you ignore every morning. Now, if you've been following along, you've probably started to see a pattern. This isn't one single cause. This is a network of causes. Sleep apnea, medications, stress, blood sugar, hydration, autoimmune conditions, all intersecting in one place. And that place is the signal your body gives you every single morning. Dry mouth. So the question now becomes simple. What do you actually do about it? Because understanding the problem is only the first step. What matters next is how you respond. Because once you understand the real dry mouth causes, once you see that this is not just about discomfort, but about your overall health, the question becomes very simple. What can you actually do about it? Let me walk you through this the same way I guide my own patients. Not with guesswork, not with quick fixes, but with clear, practical steps that address the root of the problem. The first step is to rule out something serious. If there is any chance that your dry mouth is connected to sleep apnea dry mouth, you need to get a sleep study done. This is one of the most important health tips for seniors I can give you. Because if your breathing is being interrupted at night, no amount of hydration or dry mouth treatment is going to fix the real issue. The second step is hydration, but not the way most people think. It's not about drinking a large amount of water right before bed. That often leads to waking up during the night and can actually make things worse. Proper hydration means consistently drinking water throughout the day so your body maintains balance. This is one of the simplest dry mouth remedies, but it only works when done correctly. The third step is to take a close look at your medications. If you are taking anything for blood pressure, mood, allergies, or sleep, you need to ask your doctor a direct question. Could this be contributing to my dry mouth? In many cases, adjustments can be made, and this is a critical part of effective dry mouth treatment that most people overlook. The fourth step is to retrain how you breathe during sleep. Your body is designed to breathe through your nose, not your mouth. Nasal breathing helps preserve moisture, regulate airflow, and protect your oral tissues. For some people, simple techniques, or even small behavioral adjustments, can significantly reduce what causes dry mouth while sleeping. The fifth step is to address stress at its source. If your body is constantly in a state of tension, if your nervous system never fully relaxes, your saliva production will continue to suffer. Whether it's through breathing exercises, relaxation routines, or simply creating a more calming nighttime environment, this is not optional. This is essential, especially in senior healthcare where chronic stress often goes unnoticed. The sixth step is to actively protect your oral health. Brush regularly. Floss consistently. Use alcohol-free mouthwash. Consider saliva-supporting products if needed. Because once dry mouth begins to affect your oral environment, the risk of complications increases quickly, and prevention is always easier than treatment. And beyond these 6 steps, there are 2 additional checks I strongly recommend. Get your blood sugar tested. And if you experience symptoms like acid reflux, a sour taste, or throat irritation, talk to your doctor about GERD. These are often hidden contributors to dry mouth causes that many people miss entirely. Now, I want you to take a step back for a moment. Think about everything we've covered: sleep apnea, medications, stress, blood sugar, hydration, autoimmune conditions. All of these factors, different on the surface, connected underneath, and all of them capable of showing up in one simple way: dry mouth. This is why dry mouth treatment is not about chasing symptoms. It's about understanding your body, because your body is always speaking, just not always loudly. And the difference between people who stay healthy as they age and those who struggle is often not luck. It's awareness. Healthy individuals pay attention to small signals. They ask questions early. They act before problems grow. Others ignore those signals. They delay. They assume it's nothing, until it becomes something they can no longer ignore. So if you are someone who wakes up with dry mouth every morning, I want you to remember this. Do not just reach for water. Do not just accept it as part of aging. Do not just move on with your day, because that small moment may be telling you more than you realize. If this story resonated with you, please like this video, subscribe, and share it with someone who might need to hear it, especially a friend or loved one around you, so they can also avoid the hidden health risks that come with aging. Leave a comment below. Have you been ignoring the signals your body has been trying to send you? I'd love to read your thoughts. Because next time, I'll be sharing something most people never talk about. Doctor Explains. How seniors should drink water to support blood sugar and diabetes health. Thank you for watching. And remember, your best years aren't behind you.